So we have teams that are going out with EMD, our county's emergency management department, from DPSS to pick up families at the various Border Patrol stations and taking them to our different sheltering sites. So no, DPSS is a very critical partner.
Oh, I see. Yeah, I have worked assisting EMD as well in logistic.
And just in case anyone has missed the meeting today, I'm going to go ahead and record it so that that's available.
Oh, great.
Tanya, do you want to do the introduction?
Absolutely. Welcome, everyone. In case I have not met you, I think I know some of you. I'm seeing some familiar names. My name is Tanya Torno. I'm the Deputy Director for the county's Continuum of Care Division, and we are under the county's Housing, Homelessness Prevention and Workforce Solutions Department. I know that's a mouthful, but we do housing and homelessness and workforce. But of course, we work on all those different initiatives in partnership with each of your teams. And as you may know, you are here today because our county is overseeing the sheltering component for the migrant families that are being received across 2 of our main Border Patrol stations, and may be increasing here in the future. And we thought before we jumped in to tell you what you will be doing, we could provide you with a broad overview of our efforts since March 3rd, 2021. And I definitely think it's important to state that when I say our efforts, I truly mean all the various county departments, including the agencies that you're representing, both Department of Public Social Services and County Behavioral Health. I don't see anybody here from the Housing Authority, so we're going to have to coordinate a special training for them. I think they're still trying to get.
Jasmine and Lizzie are actually here right now.
Oh, what's up? Hi, Jasmine. Hi, Lizzie. How did I miss your name? So we do have the Housing Authority team. So we have all 3 teams here today. And again, each of your agencies have been heavily involved with this effort. So since March 3rd, Riverside County has received over 500 families, I should say 500 individuals, mainly families with children who are entering our country through various access points to legally seek asylum. Some of the families that we are receiving are coming from Arizona and being supported through the Yuma Border Patrol Station. But because of the great number of families that they are receiving, they are transporting families to Blythe, a Border Patrol station there. Blythe is in Riverside County, and we're receiving those families and coordinating sheltering services. The second point in Riverside County is Murrieta, and that is the Border Patrol station, or at least the pipeline in which the families that we are going to be supporting come from. Those families are coming from San Diego. Like Yuma, San Diego has been impacted by the number of families, and so is working jointly with the Murrieta Border Patrol Station to process families and get them released into the community. So like in 2019, Riverside County very much sees this as a humanitarian effort. We want to make sure that families who are entering our county and are seeking asylum do not experience homelessness and receive the short-term support that they need to connect with their sponsors. All of the families, again, have been processed by Border Patrol. They have a future court hearing date where a judge will hear their case and determine whether they can remain in the country. But of course, while they're here, especially with us in Riverside County during such a short time, again, we want to make sure that they can navigate the different services that they need to get to their final destination. The vast majority are traveling to other states across the country. Florida is a popular destination. Gosh, I wish I could go to Florida. A lot of them are traveling to New Jersey, New York, so to the East Coast. And again, our goal is to receive them from Border Patrol and provide them with sheltering services and help them coordinate their travel, which is where you come in, so they can get to their final destinations. The big piece here, because we live in a world of COVID-19, is that we want to make sure that, or we've implemented a process so that when individuals are received at each of our Border Patrol stations, that they are tested. And so there is actually the county has contracted with a vendor who actually goes to the Border Patrol stations and administers a rapid test. And for people who test negative, those individuals are connected to shelter, and the goal is to help them coordinate their travel within 1 to 2 days. For people that test positive or have been exposed to a positive person, public health is closely monitoring those cases. So we're placing those families into hotels for 11 days until they receive the clearance they need. And once they have that clearance, then we begin to coordinate their travel. So those are kind of like the two main groups. You have the negatives who right away will be connected to you, and we'll talk in the next slides about how you will assist them with that piece. And then we have the folks who have tested positive or have been exposed and are being checked in regularly. We have public health nurses that visit each site, and once they have been determined healthy, we'll be connected with you for that same process. So I know that's a lot, but you will learn a lot of this yourself as you begin to connect with the families and they share their stories with you. I really just want to say thank you for saying yes to your supervisors who came to you and said, we need some help. This is, again, like I said, a very large humanitarian effort. And I just feel so fortunate that, we've truly been able to come together to support all of these families. So we'll jump over to the next slide, and I'll let, I think, Melanie, however you want to do it, we can tag team it, or I can let you take the lead and I can jump in as needed.
All right, and I just want to add, in addition, Tracy is on the call as well from Galilee Center. They have been facilitating all of these pieces for those coming in from Blythe and staying in the Coachella Valley. So this group will be facilitating those in the west end of the county. The purpose, like Tanya mentioned, of everyone is to help facilitate travel for these individuals, to get them connected with their sponsors and to their families as soon as safely able to do so, based on their need for isolation or quarantine because of COVID. But you want to connect with your family that is assigned to you by phone or in person at the hotel to help facilitate their travel arrangements with their sponsor or families. Some of them, their sponsor here in the United States is helping with, that you'll be working with, or their family back home is helping. So that could change. It just depends on the individual circumstances. You will be provided with a client list ahead of time, and the sponsor family will email you the travel arrangements for you to print and provide to families. So you were just helping the family understand this whole process and connecting to the sponsor to make sure their travel arrangements are made. So when you meet with the families at the hotel, you'll need to meet with them individually so that you're not talking with them with other families. And we'll explain this process a little bit more. So like I mentioned, you're there to help facilitate travel arrangements for the clients and connect them to their families or their sponsors here in the United States. Many of the clients have a phone, a cell phone with them. Galilee has been helping get them connected on the WhatsApp application on their phones so that they can communicate with their sponsor or their family back home to let them know that they've arrived here safely and to make those travel arrangements. And they might need some help and guidance through that process. So just making yourselves available to help guide them through that process and get the connections that they need if they don't have a cell phone available. So the sponsor or the family back home will be paying for the travel arrangements, including the Uber ride to the airport or to the Greyhound station. But there are times if they don't have the funds available, please let us know and we'll see what resources we can pull together to get them connected to their family. Okay, there are translation services available. Most of these people do not speak English. They are from countries all around the world, and you may not be able to translate for them. One thing Galilee has come across is if they're from Portugal, because Portuguese and Spanish are very similar, they have found that speaking very slowly and communicating with them has been able to translate for those that speak Portuguese. But if you do not speak the client's language, we do have these services available for you through the state. And this will be provided to you as well. So booking travel, working with the clients, determine where the family is traveling to and what would be the best method to get them there, whether that's booking them on a flight out of Ontario Airport or on a Greyhound bus if they're traveling to maybe just a nearby state or somewhere here in California, just finding what's the best options and helping that sponsor or family know what options are available and finding what's the best to fit their needs. Sometimes it's a matter of budget or just the quickness at which they can get there. It just all depends. You're coordinating with the families to see what works best for them on their options. Sometimes the sponsor or the family will book the arrangements themselves that you're facilitating, and they can email you have them email you a copy of that confirmation so that you can print that out for the client and provide that to them in a packet. All right. Explaining the process. The most important key is a lot of these families have never flown before or might not be familiar with flying. They may not know the ins and outs of an airport or how to go about that whole process. So making sure they understand that entire process. Print their travel tickets for them or provide the information in writing so they have it available, what their flight numbers are, what times their flights are, making sure that their Uber gets them to the airport or to Greyhound in time to get to to their flight, understanding that they need to be at the airport ahead of time and not just show up at the time of their flight. So making sure that whole process moves smoothly for them and explaining that process and what they know to expect, what airline or bus that they're taking, what their flight numbers or route numbers, if they've got connecting flights, how to get onto their connecting flight. So part of the documents that we will be providing will be like a little blurb that says, I don't speak English. Can you help guide me to my connecting flight? So that if they're in a connecting airport, say they connect flights in Phoenix and they don't speak English and others might not speak the language they have, they can kind of show them their paperwork, point to the little thing that says, I don't speak English, can you help me? And they can point in the direction and kind of guide them without having that communication issues because of language barriers. So just helping facilitate that process to go as smoothly as possible. Making sure they understand the TSA process, that they might be have a TSA body check. that they're going through the metal detectors, what they can't take on a plane, no fluids or any, even solids. I recently flew and I thought I could bring peanut butter home from the Amish in Indiana and was told I couldn't. I was like, it's not liquid. But TSA's stand is if you take it out of the container and it cannot stay in the exact shape that it's in, it's considered a liquid, even though I wouldn't consider peanut butter a liquid. So just making sure that those things that they are taking are less than 3 ounces if it falls in that category, that they can't take check batteries, sharp objects, clippers, anything like that that's forbidden from TSA, that they are not traveling with those items. Instructing them to look at the TV prompters for their upcoming flights to see if there's delays, if it's traveling on time, if flights are canceled, all of that information, just kind of giving them an overview of what to expect when they're traveling. Letting them know that there are signs that will show them where their gate is and how to find their gate on their travel information. We're going to be putting together and finalizing itinerary documents that each of you will be able to fill out with their flight information, or printing out their itineraries if you receive those from the sponsor families to you. If the client's tested negative, we'll be providing you with documentation that to attach to that and provide to the client that shows that they did have a COVID negative test. If they were in quarantine or isolation, public health will be providing us letters that says that they are clear to travel, and those will be provided to you to provide in the packet to hand the family. Okay, those should be going out hopefully within the next few hours or early tomorrow as we finalize those documents. Remember that the goal is to coordinate travel within 24 hours of clearance to travel. Like Tanya mentioned, those that come in a group that were not exposed or did not have anyone that tested positive in the group, we want to facilitate the travel as soon as possible. When we receive them from the Murrieta station, we are putting them in a hotel for the night, and our goal is to get them out by the next day. So those that come in with a group that have someone positive or were exposed to someone positive, they do have to be in isolation or quarantine. The difference is isolation means they have tested positive. Quarantine is anyone who's been exposed. And there are 2 factors in determining how long they are quarantined and exposed, and we can provide this information to you. If the individuals in that household or that are staying in the room together all test negative but were exposed, they just have to be isolated for 10 days plus 1, meaning they can travel on the 11th day. If everyone in the household tests positive, they're in isolation for 10 days plus 1, or they can travel on the 11th day. It becomes a longer stay if, say, we have a family with a mother and a son, and the son tests positive, but the mother is negative. The son has his quarantine period for 10 days, but at any point during that, the mother could contract COVID. And so their quarantine period has to extend another 10 days to make sure that during that initial 10 days, the mother wasn't exposed and potentially have COVID, and then extending the 10 days to make sure that she is through her quarantine period. So it'll either be 11 days or 21 days, depending on if it's a mixed family, that for those that are in quarantine or isolation. By tomorrow, you will receive a list of families that you were assigned to book travel for. And going forward, as we get those lists will be distributed out to you so that you can make arrangements. Please let us know if you need any personal protective equipment, such as the mask, gloves, hand sanitizer, so that we can provide those to you. And if you have any questions, I will be the point person, and I have my contact information up on the screen. It's mewilson@rivco.org, or my cell phone number is provided. Does anyone have any questions? I know this was a lot of information thrown at you very, very quickly today.
Hi, Melody. It's Jasmine from Housing 30. I actually wanted to ask, is the motel piece on top of the transportation piece, or are those two separate pieces?
So the motel piece, we have a group within our COC staff, and that includes Laura Gonzalez Rivera on the call and Joshua Tomaszewski and myself, that when Border Patrol releases them, we work with EMD to house those individuals when they arrive. It's just those that are being housed in the West End that we need help facilitating the travel piece. So that's where you guys come and play, is traveling or making those arrangements to get those individuals to their destination once they arrive at the hotel. So we are coordinating the piece where they're being fed 3 meals a day while they're here and being housed during our stay. So you guys are just focusing on the travel arrangement piece of it.
Okay, thank you.
Again,
Hi.
I said this at the beginning. Oh, hold on. I'll come right back to you. I said this at the beginning and I'll say it again. This is a very fluid process. It is changing sometimes by the hour for us as we get more information and more partners come in on this. So we appreciate the flexibility to work with us, and that things may and will change throughout this process, but we will keep everyone apprised of any changes. We're working constantly to make this process more efficient for everybody. And with that comes changes as we fine tune this process. So for a lot of us, we are new to this. Tanya did this 2 years ago. Josh, Laura, and I haven't. And so we are constantly finding ways to make this process more efficient for everyone. And so we're evolving it sometimes hour by hour. So we appreciate your flexibility. Now, I did have someone that tried to talk that I interrupted.
I'm sorry, it was me. Juan from DPSS.
Yes, go ahead, Juan.
So my question is pertaining to the flights and the travel documents that they will need in order to receive or be on the flight. What are we able to tell them to bring with them as verification of identification?
So Tracy, I think you're muted. If you could help with this piece, they're arriving with passports or travel documents already.
Some are and some are not. So we've encountered cases where they did come with passports, but they didn't get them back at the Border Patrol. So they get here only with their immigration documentation. But in the immigration documentation, they have a copy of their passport. I don't know the reason why the Border Patrol is keeping them, but that's just how it happens. But they're able to travel with the immigration documentation.
Thank you.
You're welcome.
You're welcome. I see a question from Elizabeth. Your hand's up.
Yeah, would you mind reiterating the policy for the quarantine period for those that have tested positive or are quarantining?
Sure. For those that are just sheltering, meaning that everyone within that group that was picked up that day has tested negative and have not been exposed to anyone that did test positive, we can make their travel arrangements immediately. We can begin that process right away and get them traveled and hopefully out within 24 hours. Galilee's been successful in getting them very quickly that day or the next day. And that's our goal here, to get them out as soon as possible and connected with their families. If they are, if they do test positive or exposed to anyone, then they are entered into isolation or quarantine. Isolation, again, is anyone that has tested positive, and quarantine is for anyone that's been exposed to them. For the most part, they're able to travel on the 11th day, but we have come across some families where it's mixed, where one in the household is tested positive and others in the household tested negative. In those cases where the household is mixed, it's 21 days before they can travel on the 21st day, to make sure that they are completely out of exposure, to where they're traveling, they're not exposing anybody else.
Melanie, isn't
Yes.
it 11 days? So it's 10 plus 1.
Yeah, it's the 10 plus 1.
And you have 20 days plus 1 on your screen.
That's if it's a mixed household, because it's 10 days for the initial person who tested positive. And then anyone that was in that household with them has to quarantine for an additional 10 days to make sure that if they were exposed on the 10th day, that they're still quarantined for another 10 to make sure it's out of everybody's system from without catching COVID. And then that next day they're able to travel.
Okay, sorry, one more question, Melanie. If they're still showing symptoms on the 11th day, do we extend their quarantine period?
Yes, and luckily that piece is being handled by public health, and they're in constant communication with us as the public health nurses are going out, and they let us know if anyone is symptomatic and when those individuals are able to be cleared. And so being the point person for their travel, we would be in communication with you if their stay has to be extended. So usually the travel arrangements are made very close to the end of their quarantine period. So if they're sheltering 20 days plus 1, you're going in there on day 19 or 20 to make arrangements. So we're not making arrangements on day 1 if they're going to be there for another 11 days. So you're coming in and making those arrangements at the very last point when we know from public health that they're able to travel.
Hey, Mel, this is Laura. Do you want to tell the group about the letters that public health releases, just so that they know that that'll be a good?
Yes. So let me come back here on this slide. So in addition to the quarantine document, which would hopefully be just like a 1-pager that'll tell you the family members, and then you're able to either print out their travel arrangements or just plug it in, like this is your flight connecting to, and it has all the information for their flight. Along with that, they will either get if the group tests negative, you'll get that COVID test result that says they're negative for them to travel. If there are any questions at the airport about their COVID status, they'll have that in their documents. If they were in isolation or quarantine, we get letters from public health that shows they are cleared to travel, that they have quarantined or isolated the required period of time and have completed that and are not symptomatic. That clearance letter will come from public health, and that will be forwarded to whoever is their travel arrangement person. So all of those documents will come from our team to you so that you can provide that, print that out and provide that to the clients. I have a question from Pedro.
Yes, in communicating with the immigrant families with their itinerary, I understand that they may not have the ability to print out or email or that type. Are we this is a hypothetical. We're expected to go there and give it to them now, but that's not my question. That's a given. If it lands on a weekend and we don't have access to county vehicles or the cage or something of the sort, are we being provided with mileage for, I'm assuming yes, hoping? Are we expected to use our own vehicles, or?
I can jump in. Pedro, so that would be a question to ask your supervisor. We, just so you know, prior to the meeting we're having with everyone here today, we did meet with each of the supervisors to talk to them about the needs and expectations. So we did stress that there would be a need for some weekends and that we would do our best, right, to let you know as far as in advance as possible. I think in regards to like reimbursements, OT, any of those questions, I would just recommend that you follow up with your supervisor. I'm sure that they will be accommodating and have some quick answers for you on that.
Great, thanks.
I have a question.
Thank you, Tanya.
I'm sorry.
Go ahead, Candy.
Okay. I have a couple of questions, actually. So we're going to be assigned, are we going to be assigned close to where we live? That's number one. Or like in the areas that we work in, like if I work in San Jacinto and Paris, would I be assigned to Murrieta? Also, I'm assuming we're using our own vehicles, and is this a volunteer service we're doing? Which, you know, I don't mind, but I'm just asking just so we can get a general idea of what's expected of us. And how many days of service? Are we going to be weekends or during the day or night?
I can tackle that. So I want to make sure. So I think there was a reference about volunteer, area of service, and then like expectations as far as like the number of days that you would be working. So while I think I'm the one that used the word volunteer at the beginning. You know, it is our understanding that everyone here will be utilizing county time to carry out these services. So you should work with your supervisors to make sure that you are documenting all of the time that you are putting towards this effort on your timesheets. And so you may just want to check with your supervisors on like the best way to do that, which Melanie reminds me we'll probably want to email the supervisor so they can begin to like maybe add a separate line item on their timesheet so they, right, like in the future when the state or federal government allows for counties to apply for reimbursement, it'll be very easy for fiscal persons to be able to do that. But yeah, talk to your supervisor. You should definitely be documenting your time on your timesheet. You're going to get paid for this. In regards to area of service, I'm so glad you brought that up. Each of you are being recruited to support the families that are received from Murrieta Border Patrol. Currently, those families are all being transported to hotels located in the Corona, Riverside, and Jurupa Valley area. So we're currently working with 3 hotels. And when you receive your client list tomorrow, it'll tell you which locations. We'll absolutely do our best so that, right, if you're assigned to families that, you know, to the best that we can, we'll try to group you so that the families you received are all at the same hotel site. But again, just depending on how large the need arises, because Border Patrol drop-offs are happening each day, you know, we might need to expand your reach. But just so you know, at least for now, you will be supporting Corona, Riverside, and Jurupa Valley locations. In regards to expectations, wow, how many days am I going to work? What are the hours going to look like? We're truly looking to keep you on an 8 to 5 schedule, so 8 a.m. to 5 p.m. In regards to how long, like throughout that day, you'll be working on this effort. Right, we've seen Galilee Center and learned from them that, right, normally they send out 2 case managers to their sheltering site and they can process about 15-20 families in 2 to 3 hours. But they're bringing printers, portable printers and laptops to the hotels to get everything done there. Obviously, not all of us have access to portable printers. It sounds like the DPSS staff, your supervisors have split it up, so you have some people working in the office and some people going out into the field. So right, like everyone's, you know, you're going to develop your own system, so it might take a little bit longer than that. But definitely we're going to try to keep you 8 to 5, and then weekends are definitely a possibility. What I will say is that the number of families that we are receiving vary day to day. Right now, just to paint the picture, we have, I had the number earlier, but I think we have like 20 families, right, that are clean, they tested negative, and they're ready to be connected to you to begin the travel coordination piece. But we also have 60 families who have either tested positive or have been exposed. Actually, 3 tested positive, the rest were exposed. Those families, we're waiting until they finish their quarantine period before we can connect them to you. And as Lizzie mentioned, right, public health has nurses that are visiting, you know, every other day in person with each of these people. So they're going to give us an official letter that says this person is good. You can work with them. So I think those 60 families get cleared April 9th. So like on that day, we will connect with you to tell you, okay, this is how many families you're working with. At the same time, again, I want to be very realistic. Border Patrol could very well release families every single day in the next couple of days. So, right, the number of families that you'll be assisting and doing this for could increase. And that, right, may require you to work on the weekends. So we'll work together. I think what we're looking for and what we asked your supervisors for were flexible people that knew, hey, we're in this together, we're learning. We're obviously starting with a process, but we can absolutely fine tune it and make it better so that it becomes more efficient with time. The long-term goal and what Melanie, Laura, and I and others like Josh are working on is identifying a nonprofit organization like Galilee that can take this over in the next 3 to 4 weeks. So we're having some positive conversations, but until then, we need you to help us help these families.
Right. Marcus, you had a question?
I apologize. I'm trying to just get a full understanding. I apologize for coming in late if there's any level of redundancy to my questions, but I'm trying to understand, are we augmenting each other's schedule, or are we talking about this being someone assigned to this every day, 8 to 5?
We would prefer if we worked with the same people. So our ask to each of the supervisors from the departments were give us 2 people that we could work consistently with. Because, right, there's a training component, we're all learning together. But just so you know, Marcus, and I think it's creative, but like DPSS is basically, I think they're bringing on like maybe 8 different people who are going to be working, you know, different days during the week and kind of teaming up together to facilitate the travel coordination. So we'll see how that works, but I think our recommendation is, again, not to say that this is bad, but I think our recommendation is if you have the capacity, you know, instead of using different staff, it may make more sense to bring in like 2 full-time staff to just do this effort. Because the training component, as you can see, is going to take time for people to really jump in and learn the process. Hopefully that helps.
All right. We have a question from Juan.
Yes. Hello. I just was wondering on the days. I'm part of the DPSS staff. On the days that we are to work on this or these efforts with you, are we checking in directly with someone, and who's our contact person to check in with? Okay.
Me.
Alrighty.
All right.
That was good.
All right, Rolando, you had a question? Rolando, you're muted. You have your hand raised?
Yes. Yeah, I
There
have
you
a
go.
question. Are you gonna send us information with the case and where to report?
Yes, once you're assigned a family to arrange travel for, we'll send you the information for that family, the dates of birth, their names, where they originated from, and what hotel they're at and what room number.
Okay, thanks.
All right, I'm gonna go through Graham or Lance Graham. You have a hand up?
Yes, I wanted to ask, will we be transporting any of these participants?
No.
No. So I think on one of the slides where we started, you know, kind of breaking down the travel coordination, we included that in that conversation. So as you're working with the sponsor families, you want to arrange for both the airfare or Greyhound. We're totally pushing for airfare just because it gets people to their final destinations quicker. But ultimately, right, the family decides. We're also encouraging you to let the sponsors know that the families will need travel arrangements to get from the hotel to the airport. So for that, right, we're encouraging the use of a taxi service to facilitate that. And then they can send you the arrangements by email as well. I think what I will add to this is we definitely want to push for families to, right, their sponsor families. We want them to pay for these costs, the entirety of these costs. There may be some families that you're working with where the sponsor family says, you know what, I just can't afford the tickets. In those cases, for now, we just want you to like note them, highlight them, email those that case information to Melanie. We are reaching out to a provider as we speak to see if in those cases they might be able to work with the sponsor families to purchase the tickets. But we don't have that deal sealed quite yet. So for now, again, we really just want to push for the sponsor families to take care of all the costs.
Thank you.
Okay. Eddie, you have a question?
Yeah, hi. What if we get a list of our families that we have to make arrangements, but then we're not able to, like, for example, we're out sick or we're just not in the office or whatever. What do we do? Do we let you know that we're not able to?
Yeah, just let me know so I can get someone else assigned.
Okay, great.
Hopefully we're gathering a good pool of people, so hopefully that will really help in facilitating this. So we've got, you know, more arms to extend out and say, hey, can you give us a hand? All right, Candy, you've had your hand up?
Yeah, I was wondering, we're going to get these assignments. So are you going to send us your information so that if we have questions, we will have your phone number and we will be able to get in touch with you? Oh,
yeah, right. I have it back up on the screen.
Okay, great. I got it. Thank you.
Okay. And Zenaida, I apologize if I mispronounced that.
Zenaida, that's fine. So Melanie, does this mean this is pretty much sporadically that you will be notifying everyone with the families, right?
Yes.
So we continue to come to work daily as usual. Great. Great to know. Thank you.
All right. Yeah, from every day and sometimes from the morning to the afternoon, it changes and we get all of a sudden notification that says, hey, we have a group of people at this border patrol that we didn't previously know about. And so we've just had to be very fluid and flexible through this process to just try to.
Melanie, what about on the weekends? Do you notify anybody?
Weekends? It's 7 days a week for our team.
But how would you contact us, on our private cell phone, or? I mean,
we'll need to work on that, like a schedule to know, like, you're going to be working this Saturday and giving you that advance notice so that those that are tapped to work on the weekend, you're given that advance notice that you're essentially on call.
Okay.
Fantastic. To handle that.
Thank you so much, Melanie.
You're welcome. Pedro, you had another question?
Yes, when it comes to documentation and billing, is there a billing component, or how do we report our activities? Is there a trail that we need to keep, and how do we go about that?
That's a good question. So Pedro, are you talking in regards to like your time, right?
No, not our time,
okay.
But just service that we provide, like when we bill for a client or a member here at our agency, we document the services that were provided. Is there some type of note taking, or do we just get the family, get them on board, do the work, and send them on their way and say family taken care of, and kind of like a checkoff list?
Okay, that's a good question, and let me answer that. So the itinerary document that we're going to send out to you to fill out for the family. When that's all completed and you know when they're departing, send that back to us. Send it back to me so that we can enter that in our database and we know when the family is exiting. Because again, we need to make sure if, say they're planned to leave on the 11th date, but their flight isn't till the next morning that you were able to book them on, we may have to extend their hotel for another night. And so we need to know when they're leaving so we can make those accommodations.
All right.
So also, when you're out there in the field with the clients, if you come across someone that's sick or needs additional services, maybe someone's having mental health issues and you're concerned, just communicate with us so we can bring in our partners. We do have mental health on call. Should we have someone that needs someone to come talk to them, or if we've had some that arrived with a sick baby that wasn't COVID related that we needed to get medical care for. So you're out there in the field. Our team is not out in the field. So if you do come across something, an issue to be concerned, just let our team know and communicate with us. We have also had individuals that were placed in the hotel and that we're working with to try to get their travel arrangements, and they just all of a sudden hop in a taxi and take off and they disappear from the hotel. That has happened. We know it's going to happen. If so, just communicate with us that, you know, you've unable to locate the client. Hotel says they haven't seen them. You know, just let us know because we have had that happen.
All right, thank you.
Laura, Josh, Tanya, you guys have anything else that I missed in covering?
This is Laura. No, I think that's a good overview of what we've been working with. Of course, situations that are new may come up, but we'll work on them together as we encounter those.
I love that you said that, Laura, just because, again, we very much are creating this process as we go. Yes, we did this in 2019, but we didn't have COVID-19 in 2019. So it was a little bit easier to get people out at least quickly. I would just want to thank you for participating today, for your willingness to support this effort. And my hope is that you will provide us with feedback along the way so that we can strengthen the process. This is, at least for the Murrieta group, this is the first time that we are assisting with travel coordination. And as Melanie mentioned, right, we're going to work to get you your client list tomorrow morning with the itinerary document that you can use to capture the travel information, and we'll go from there. Again, the biggest thing is we want to try, when you connect with families tomorrow, the goal is to try to get them out that day or right at latest the next day, just because we are using hotel vouchers, and if any of you support hotel voucher programs, you know that the number of hotels we have available is small, and so the quicker we can turn around people, the quicker that you know, or the better. It's better. We have a better way of ensuring that we can receive new families and have a place to put them. So thank you, and big shout out to Melanie and Tracy, who on very, very short notice this morning put this entire training process together. Great work, guys.
Let me just add one thing. I know there's been questions about the quarantine or isolation and the number of days. That information will come from our staff when we send you the family list for you to work on, so that you're going to know what day they can travel on. So it's not something you're going to have to calculate. It's just, we wanted you to understand the process in case you get asked questions, so that you know what the situation is. But that information is going to come from our staff, which is going to be based on their results or guidance from public health if their stay needs to be extended. So that information will be provided. Elizabeth, you have another question?
Yeah, I just wanted to clarify, will the families have transportation from the Murrieta facility to the hotels?
Yes. EMD is providing that transportation. They pick them up each day as soon as they're released. They test them and then transport them and drop them off at the hotels, in which our team is coordinating which hotel to put them into.
Thank you.
You're welcome. Any other questions? Elizabeth, you have another question?
It's a different Elizabeth, but yes.
Oh, I'm sorry.
No worries. For those of us who are making the phone calls to arrange the travel, are we gonna have a script to go off of, or is just something that we're making up as we go? Do we have any assistance with what we're supposed to be saying? Anything like that?
To be honest, we don't have a script yet. Like I said, this kind of just landed in our plate a few hours ago. We've been trying to pull this together as best we can. That's why Galilee, we've kind of tapped them and brought them in on this. Tracy, do you guys have a script that you can share with us that we could potentially modify?
Yes, I could definitely send it to you through the email and you can modify it to your way.
Thank you so much, Tracy.
You're welcome.
Candy, you have a question?
No, I just wanted to say that, you know, we work in the behavioral health field, so you have about a handful of us that are willing. So if any of you guys need resources, or if you have a family that is going through something, because I mean, coming from another country, they're traveling, they're scared, they don't have family or resources here, they don't know what to do. That's what we do every day, so we're used to that. So feel free to connect with us and we can see what we can do to help as far as that goes regarding behavioral health. And I'm all for families, like children, everybody. I want to help them all. So I'm glad that, you know, you offered this service because we're excited.
Thank you, Candy. And again, if you identify someone in need, just reach out to me and we'll get you plugged in with someone at Behavioral Health. All right, Pedro, you have a question?
Yeah, piggybacking, sorry for too many questions. Piggybacking on what Candy said, should a need arise, where do we link him to? Do we go directly to you? Are you the referral process person?
Yes.
Do these families have, let's say we connect with them and then do we give them our county number for them to have access to us? Do they have a number they can call should a need arise?
Tanya, you want to take that one?
You know what? I'm sorry, guys. I missed it just because I was responding to an email. Do you mind saying that one more time, Pedro?
Right. So let's say we make contact for travel arrangements with the family. What contact number do we provide them with? So should they have, let's say we meet with them at 1 and they have questions, do we provide them with our county number?
Yes.
Yeah.
Yes.
Okay.
Yes. So my hope is that each of you have, right, like a mobile work phone, because that will be absolutely necessary to move this process along. From my experience in 2019, right, sometimes I was calling the sponsor family, I left a message, and then they would call me back an hour or two later to say, hey, got your message, I'm ready, what do I need to do? So thank you, Pedro, great question. Please do share your county, hopefully mobile numbers.
Okay, our hope is that you guys will be coordinating with the client and the family on the whole travel piece, but should you need additional services or additional questions, that's when you'll reach out to me and I'll guide you to who you need to go to or get an answer back for you.
Okay. Thank you.
You're welcome.
Hi, good afternoon. This is Sonia Pepperary. Hi, Melanie.
Hi, Sonia.
I just had a question. I am supporting Lance Graham, so I just wanted to check pretty much for setting all of this up for the migrant families. Are we just going to be working primarily from our offices, or will we need to coordinate in person with any of the motels to set up their arrangements?
Some you might be able to reach by phone at their hotel rooms and reach the family by phone. If so, amazing. If not, yes, coordinating at the hotel with the client. For the most part, this should not involve the hotel managers. You would just be working directly with the client individually. So.
Okay, thank you.
I have a hand up from Elizabeth.
Yes. For those of us who are unable to go to the hotels, is there going to be a system in place for those of us who can make, you know, the phone arrangements through the phone or whatever? Is there going to be a, you know, something in place where someone else can take over, like handing over the documents?
I can step in. Elizabeth, I think our plan, right, is I think you would need to coordinate that or like work with the other people from your agency to coordinate that type of coverage. Essentially, right, you're going to get a list of clients that are assigned to you, or they're assigned to you, but we'll break it down by agency. And so I think you're asking the right question, because I can imagine, right? Like, I work today, I may be out sick tomorrow. So it would just be essential, like, that in those circumstances, like, you develop some kind of buddy system so that another person can step in and support you. In the event that you don't have that, right? Like, let's say everybody from your agency that's working on this is unavailable, then please do, like, work with Melanie, make Melanie your best friend. And then she can, like, work with the different people on the teams to get some backup support. But I think our hope, right, is that you guys will develop any type of backup systems that are needed within your individual agencies.
And to answer that specifically, Elizabeth, maybe you and your partner, if you're able to connect by phone, that you take those, and your partner that's able to go out to the hotel, they get those clients. So that'd be just something you work with in your buddy system. But if you do run into issues that you can't resolve, just let me know and we can always tag team someone else in.
Perfect, thank you.
You're welcome. Any other questions? All right, so following this, I'm going to send out a link to the video. Should you want to refresh it, I'll send out my contact information and a copy of the presentation, so that you guys will have that. I'll send that out to everyone on the invite here today. And if you have any questions, my contact information is up, and it'll be in the email that it goes out as well. Any other questions before we end the meeting?
No, thank you for all the information, though.
Thank you, Melanie.
Looking forward to it.
Thank you, Melanie.
Thank you, Tanya.
You know, we appreciate the flexibility. This is ever evolving, ever fluid. Like Tanya says, we are learning on the fly as we go with this. So it's a process that is constantly being refined and polished, and made more efficient as we go and as we learn mistakes or issues that occur in implementing procedures into that. So
it'll be fun, we promise. And you're gonna love the families. See you later, guys. Thank you.
All right.
Thank you, everyone.
Thank you.